Thank you for joining us today. I am Abigail Zabrodsky, a Hajim School of Engineering member of the class of 2014 and a member of the Simon class of 2019. I am also a member of the Alumni Board, a group made up of 25 members representing each of the university's schools with the purpose of engaging all alumni and students in a lifelong connection with one another and with the university. Today's lecture is part of a new series called Experience Rochester that exemplifies the university's commitment to lifelong learning. The series features topics and speakers unique to the university. We have a wide range of registrants joining us for the session, including students, parents, and alumni from as far back as the class of 1955. Now, I would like to introduce today's lecture. Today, we are joined by a panel from the Hajim School of Engineering who will introduce a number of recent studies that use social media and machine learning to analyze different aspects and responses to the pandemic. After the presentations, Wendy Heinzelman, Dean of the Hajim School, will join us to moderate a discussion. Professor Jiebo Luo, Professor of Computer Science, will start the program off for us. Thank you again for joining us, and I'll turn it now over to Professor Luo.
Thank you, Abby, for the introduction. So next, I'm going to share my screen. Hope everyone can see my slide now. I'm Jiebo Luo. I'm a professor of computer science. I will spend the first 10 minutes to cover some contents, and then I'll invite my student Hanjia Lyu and Yipeng Zhang to speak for 5 minutes each. Today is my great pleasure and our great pleasure to share some of our recent work on using social media to understand the COVID-19 pandemic. Let me first offer some background. As we all know, the COVID-19 pandemic has severely affected people's lives and caused tremendous economic losses worldwide. Yesterday, the number of deaths in the United States alone has surpassed 200,000. So the influence of the pandemic, many aspects have been studied by the academic community. However, the influence on public opinions and people's mental health conditions have not received as much attention, and that's what we'll focus on today. In the literature, for this type of study, researchers have been relying on interviews and surveys, which can only provide small-scale observations. Given the rise of social media in our lives, we have a new opportunity to study many aspects of a pandemic, both at a large scale and in real time. And meanwhile, given the recent advances in machine learning and data mining, we could perform automatic analysis using massive amounts of data. I also would like to share some of the press coverage of our work. On May 30th, IEEE, which is the largest professional association for advancement of technology with over 400,000 members worldwide, featured our work on the analysis on COVID-19 tweets in its flagship publication, IEEE Spectrum. And this coverage happened to share the headline with the news on SpaceX returning US astronaut to space. So we are very pleased that our work has received broad attention. And we are even more pleased that just a week ago, the US Congress passed a resolution condemning anti-Asian sentiments. So that's another evidence that our work is relevant. So today we'll cover 4 pieces of research. I'll cover the first 2 projects, and each of the 2 students will cover the remaining 2 projects. First, let's look at the project on characterizing Twitter users and topics regarding the use of controversial terms for COVID-19. Although the World Health Organization, WHO, has officially defined the disease as COVID-19, as we all know, other terms such as Chinese virus, China virus, are still being used by a great number of people. When people refer to the virus, they have two options. They can use non-controversial terms like coronavirus, or they can use controversial terms like Chinese virus or Wuhan virus. Through our study, we are able to find significant differences between two groups of Twitter users across their demographics and social characteristics, such as the number of followers, political following status, and their geolocations. Overall, we found that tweets using controversial terms contain a higher percentage of anger as well as negative emotions. They also tend to point to China more frequently. Given the time and the broad audience, we'll focus on the findings instead of the details of the data analysis algorithms we use. So this is the first findings we have. We found that younger people tend to use non-controversial terms when referring to COVID-19, as shown by the figure on the left. So for the age groups of younger people, you can see the gray bars are higher than the blue bars, which means more people choose to use non-controversial terms. And on the right, we have a breakdown by gender. As you can see, male users constitute a higher proportion of Twitter users. However, the proportion of female users in the non-controversial data group, ND, is higher than that in the controversial data group, CD. In terms of social characteristics, we also find that users in the ND group has been used in Twitter for a longer time, which means they are more experienced. They tend to have a larger social capital, which means they tend to have more followers, more friends, and status updates, as indicated by the 5 plots on these slides. In addition, we also find the proportion of verified users by Twitter in the ND group is higher than that of the CD group. These users were certified by Twitter as credible users. Next, we look at the political affiliation or political preference of users in the two groups. As indicated by these 2 pie charts, we can see that there are more users following Donald Trump in the controversial data group than in the non-controversial data group. And also in terms of the candidates for the Democratic Party, the proportion of users in the ND group is higher. Next, we look at the users in terms of their geolocation. As indicated by these 2 pie charts, users living in rural or suburban areas are more likely to use controversial terms than those living in urban areas. We also look into the details of topics in these controversial posts, and we found that the topics are more related to China, even after we remove the phrase China virus or Chinese virus from the data. We can still find indicators that point to China. In contrast, the discussions in the non-controversial posts are more related to fighting the pandemic in the US. These 2 fancy-looking charts basically shows the differences across the sentiment of the tweets posted by users using controversial terms and users using non-controversial terms. I would direct your attention to the plot on the right. The orange curves correspond to non-controversial term users. So as you can see, they focus more on work, they exhibit more positive emotions, while the users or the tweets in a controversial term group exhibit more negative emotions and more anger. All right, let me move on to the next topic, where we focus on how college students respond to the pandemic in comparison with the general public. Following the closing of the University of Washington on March 17th, more than 1,000 colleges and universities in the United States have canceled in-person classes and campus activities. In this study, we want to discover the social implications of this unprecedented disruption in our lives between both the general public and the higher education community. And we discovered several topics embedded in a large number of COVID-19 related tweets that represent the most central issues related to the pandemic, which are of great concerns for both college students and general public. And more interestingly, we find a significant difference between these two groups of users. For example, college students tend to focus their discussions on topics closely related to their lives, such as school closing and local news. In addition, we can see that most of the sentiments expressed towards COVID-19 related issues are negative. And college students tend to be more negative than the general public. This is not entirely surprising because younger people tend to show stronger emotions. And we look at a few topics involving social distancing, school closing. We found worrisome emotions. All the tweets revealing concerns on school closing are negative. And many students actually exhibit aggression towards the foreign community, blaming them for the disruptions in their lives. Certainly, college students also discuss their feelings towards online learning experience, and most of them show dislikes for remote learning. Finally, I want to point out something very encouraging. That is, our college community remains aware and vocal on the racism problems related to the Chinese virus controversy. This is a bright spot, and it sends a powerful message on the public's intolerance of racist behavior. And this is important for the betterment of our society. Next, I'm going to invite Yipeng to talk about the project on monitoring discussion trends during pandemic.
Hi, I'm Yipeng. So I'm going to present our work on monitoring depression trends throughout COVID-19. As Professor Luo mentioned, psychological impacts of COVID-19 have yet to be studied, but it's very important because people have been quarantined, working from home, and interacting with friends and families less often. So we focus on depression in this study and choose social media as our main data source. We create by far the largest English Twitter depression dataset containing 2,575 distinct identified depression users with their past tweets. We train some deep learning-based classifiers using this dataset, and then inspired by psychological studies, we create a fusion classifier that combines deep learning model scores with more features such as psychological text features and users' public demographic information. Previous studies have used some, it's a previous slide. Previous studies have used some older machine learning models for user level classification. And all this works focuses on small samples of fewer than 500 depression users, except for Sheng et al., which to the best of knowledge is the only one that includes 1,402 depression users. So in our study, we created a data set of 5,150 Twitter users, including half identified depression and half as control group, along with their tweets within past 3 months and their Twitter activity data. We're also the first to apply the models to the population level. Here's the performance of 5 deep learning-based models. The first 2 are the ones that perform relatively well in previous studies, and the bottom 3 are the much newer ones we use in our study. For each model, we progressively add training data and to the model, and we see clear performance growth on all models, which validates the importance of our data set. And the newer models we use outperform the previous one by a great amount. We further build a more accurate classification model upon the deep learning model, along with linguistic analysis of dimensions including personality, psychological word count, sentiment features, and demographic information. We also analyze how each of them relate to depression signals. Then we apply our model on the group level and population level in order to monitor the depression trend. And we further analyze them by a topic machine learning model that discovers what people talk about during the up and downs of this trend. So the first part of the monitoring is on the depression group, denoted by the red line on the left plot. And the control group, which is denoted by the green line. So on this plot, we have their depression levels from January the 1st to the end of May. It might be hard to see, but their scales are different, and the depression group actually has a much higher depression level throughout the time span. We do see some interesting things here. For example, both groups' depression level increases after the announcement of US national emergency. The right figure shows the topic distribution of each group's tweets, both before and after the emergency. And the two groups' topics have different focuses. We first analyze their differences based on psychological studies in our paper. Then we move on to the population level. Here on the left, we show the trends of US users as a whole and 3 representative states, New York, California, and Florida. All states show very similar trends, as you can see. And interestingly, Florida exhibits the lowest depression level. As in group level monitoring, here we also use the topic model to discover the topic distribution differences between the states. For example, people in Florida seem to talk more about life changes during COVID-19, while people in New York more about hospital news. Possibly due to the fact that NYC's hospitals were heavily populated during the time span. Thank you. That's all for this study.
Hi, I'm Hanjia, and I'm going to talk about the project we have studying consumer hoarding behaviors during the pandemic. Next, please. Yeah, during the COVID-19 pandemic, social media has acted as a double-edged sword. While it is a rich source for obtaining useful information concerning the pandemic, it also shapes the fears. When people see tweets about panic buying online, they probably will go panic buying themselves. We analyzed the hoarding patterns of more than 40,000 Twitter users in the United States over the past 3 months, and I will go details in the following slides. Next, please. So first, we apply a rule-based method to separate the tweets and their authors into 2 groups on the basis of whether the tweets indicate hoarding behaviors, and we will label them as the hoarding group HG, or the tweets express the idea of stopping hoarding, not hoarding group NHG. So in the tweets, we found there are differences between the consumers of HG and NHG groups across demographics, the population density of their locations, whether they live in the coastal states, but no significant difference over the family status, whether they have kids. Next, please. So here are what we found. Younger adults who are like between 18 years old to 35 years old, they tend to post tweets that ask people to stop hoarding. The proportion of females of not hoarding group is significantly higher than that of the hoarding group. And also we found that urban citizen users, they are proportionally higher in HG than in NHG group. What's more, the consumers living in the coastal states, they tend to post tweets that tell people to stop hoarding or panic buying. So to find out what people are really talking about, we apply a topic model called LDA model to investigate the difference of the topics between the HG and NHG groups. Here the tables is the topic of those 2 groups. The tweets of the HG group focus on food, toilet paper, and medical stuff, while the tweets of the not hoarding group, they focus more on toilet paper, public health, and food shortage. And moving forward, we try to understand the topic in a temporal manner. the food was always the major topic of holding group during this time period. Even there were fluctuations, the overall proportion of the food topic was increasing. The proportions of the other two topics decreased as the pandemic developed. The discussion about the toilet paper was once heated around March 11th, which is in line with the news reports. And moreover, we try to apply a lexicon tool to analyze the sentiment, the tweets they express. We found out that the anxiety scores for the hoarding related tweets are higher. The look anxiety mean, the look is the lexicon tool we use to analyze the sentiment. The look anxiety mean for the hoarding related tweets is significantly higher than that for the general tweet contents. And that's what we find for hoarding. And next, we will have time for questioning, answering, and the future discussion. Thank you.
Great. Thank you so much, Professor Jiebo Luo and our students, Hanjia and Yipeng. This was a really interesting study, or several interesting studies that you've done. I do want to reiterate that anyone who has questions, a number of questions have popped up in the Q&A. Please keep your questions coming there and we'll get to as many of them as we can. But I wanted to start with a general question, probably for Professor Luo. Asked Jiebo, what motivated this research? How did you decide, and it was obviously very timely, how did you decide which terms to use, which different areas to search tweets for? Because obviously there are a lot of different areas you could have explored within the pandemic. How did you make those decisions?
Indeed, there are many things that we could have studied. We focus on things that we think are most relevant to people's life. For example, mental health, food shortage, hoarding behavior, as well as public opinions. So for each topic, we need to choose a proper set of keywords in order to do the search on Twitter. So I'll ask each student to give a little bit more detail on the specific project. Okay, go ahead. So Yipeng and Hanjia, you can describe how we choose the keywords.
Yes, Hanjia, why don't you talk about the data gathering process?
About the keywords, like for the first project, how to identify the people or characterizing the Twitter users using controversial terms and non-controversial terms. We used a rule-based method, like we just use keywords and hashtags. For example, if we want to find out the Twitter users who are using the controversial terms, we will use keywords like Chinese virus, China virus, Wuhan virus, and also we will use the hashtags of them. But yeah, I saw one question in the Q&A. They asked about whether we will use fake virus. We didn't include that in our project. And that's for the first project. And for the hoarding related tweets, we use similar keywords like hoarding, panic buying, and other similar keywords. Yeah.
So for the depression project, we gathered a list of regular expression. It's kind of like keywords to search for the depression symptoms. For example, I'm diagnosed with depression, or I'm fighting depression, something like that. And we have an automatic process to gather this depression set, and we use some COVID-19 related keywords to gather the control group. And it's the control group is random sampled from a much larger pool.
Great. Great, and there's a number of questions about how you got the data from Twitter and how you were able to access so much data from Twitter. And in particular, so I think two questions here. One, how were you able to get so much data from Twitter, and how were you able to get information from the tweets, things like demographics? I think, Hanjia, you mentioned that there were cases of with kids or without kids. How did you know that the Twitter users had these different profiles? And then lastly, the third part of this is, how did you know the tweets weren't from bots?
Oh, yeah. So maybe I should ask? I should answer?
Yeah, Hanjia, you can start. I'll just add a few more comments at the end.
Okay, so for the first question, how do we collect these Twitter data? We use Twitter public API that is provided by Twitter itself. And we use that API to stream Twitter data by choosing the keywords. For example, for the first project, we choose to use that streaming API during the end of March. And in these days, all the tweets posted online will be sampled by that API, and we can download those data. And for the second question, how do we retrieve the demographics information, or whether he or she has kids or not? For the demographics, we use the Twitter profile image, because when people use a Twitter account, they will post their selfie or other group photos. So to better understand what's the demographics of those Twitter users, we just choose to pertain the Twitter users that has a photo that only has one intelligible face. And we will use a state-of-the-art machine vision tools called Face++ to identify whether identify the gender and the age of that user. As for whether the family status, we will use the rule-based method, like Yipeng has mentioned before. We will try to find whether they have revealed any information about whether they are a father or a mother in their Twitter description, because there is a Twitter description in their profile. Yeah.
Okay, so I'll just add to what Hanjia just said. In principle, we use machine learning techniques. So we label some data for which we use humans to determine age, gender, race, whether they have family or not, right? So this forms a training data set. On top of that, we use machine learning to build classifiers that will predict or infer demographic information in terms of age, gender, race, and then we use that information for the subsequent analysis. There was a question on, how do we know it's a bot or a zombie user? That alone can also be detected by machine learning. In other words, we can label some fake users, real users, and then based on the content, right? So we can classify users as either fake or real. And also, as I mentioned at some point, there are these Twitter certified users. So they are real. They are certified by Twitter.
And how accurate are your classifiers? So for things like demographics or for real versus bot type users?
So in general, if our classifier can achieve an accuracy above 90%, then we use them. If it's lower, then we may not use such classifiers because the information is not as reliable as we want.
Okay, great. And a couple questions came up about timing. So it seemed, first of all, how long were the timing? How far from the earliest tweet to the latest tweet? Was this up over a month, over 3 months? And would you expect that there would be any changes in your results if you did the same studies now? So if you did a comparison of any of the studies, I would imagine hoarding would be very different now than it was 3 months ago, but maybe depression. Have you thought about any long-term follow-up looking at changes over time?
That's an excellent question. So in most projects, we use a duration of about 3 months. Okay, but on some of the topics, we intend to redo the whole study given how the pandemic has evolved. For example, for the college student, we only include the first 3 months, which was the spring semester in the study we just reported. So we are going to do another study for the fall semester to find out if the student would have different opinion or they have adapted in what way. So for some topics we do intend to continue the study for an extended period.
Great. And one thing that has come up here, a question about what in the results surprised you, what conclusions did you come to? And I'll add to that question of, have you shared these or have you collaborated with anyone, for example, with psychologists? because it would seem like there's a lot of data that you're mining here that could be a gold mine to psychiatrists, to psychologists, to help them figure out tools to how to use this data and these predictions to help people, for example, with depression, to address depression and to try and treat it and detect it early on.
Oh, yeah, these are all excellent questions. So some of our findings are consistent with what people would have expected, right? But even that, the fact that we were able to use a large population and quantify how truthful, how accurate that common belief is of great value, right? For example, we think, people in the rural areas may use the controversial terms more, but to what extent? And that's something provided by our study. Even on things that are not so surprising, we were able to provide quantitative answers as opposed to qualitative answers. We did find some surprising things. I'll ask the student. I think they know more detail than I do on the most surprising findings. And then I'll come back to answer the next question. So Yipeng and Hanjia, what are the most surprising findings in your research?
I can go first. Then please.
Yeah.
So in the hoarding related project, we also try to find what's the food, or what's the food people are paying most attention. I think people can have a guess, like what's the food all the Twitter users, when they express hoarding behaviors, what's the most important food to them. And according to our analysis, we found that people show most anxiety when they talk about beer. I think that's, that's one interesting, finding.
That was something confirmed by myself. I think we purchased more, not heavy alcohol, but beers certainly during this stressful time. That may not pop up as the first thing on anybody's guest list, but that's what we found. And then Yipeng, you have an example?
Yeah, for the depression project, the one thing we noticed interesting is that after the COVID-19 pandemic or national emergency, at one time point, the non-depression users actually has an increasing trend much earlier than the depression users. So one of our collaborators is a psychology major, and we went to search for some psychological theories to explain that, and it turns out that those who already have depression are kind of less affected by the outside, the bigger environment. So like the normal people will get stressed out first, then the depression group follows have an increasing trend.
Interesting.
Yeah, so I will just answer last part of Wendy's question about who would be able to take advantage of our findings. I think in general, the government agencies, the university administration, because let's say we studied the college students' response, and also even retailers, right? Because we studied hoarding. So they can take our finding and design strategies to make sure there's enough supply and that the university addresses students' biggest concerns, and that the government take measures to calm public fear. So these are just some of the ways that our findings can be used for the general social good.
Right. And some questions have come up, and I'm very interested in this topic as well, about bias that can come into play in doing some of these analysis using machine learning and AI. And in particular, you can get biases, for example, if you are looking at pictures and trying to determine gender identity, there could be a lot of biases that come in by doing that, or by determining family status or things like that. So I don't know if any of your work has addressed that, or if you've thought at all about how to do this work and try and make it as unbiased as possible.
Right. This is a very important issue. I think AI and any machine learning algorithms can actually inherit bias that's embedded in the data. So we are fully aware of these pitfalls. But I would argue that our approach, because it's based on big data, would offer some ways to reduce the effect of bias as compared to polls and surveys, right? Those polls and surveys, they rely on even fewer subjects. And in the process of recruiting, responders, then a natural bias could have been introduced by the recruiting process, which is not an issue in our study. And also in our approach, because we're not actively asking for answers, we avoid disturbing the subjects, because what can happen in a lot of surveys is the subject may not answer the question truthfully, either subconsciously or consciously. Okay, I think there are examples of that. But our approach is based purely on passive observation. In other words, we didn't ask them. We observe them, we infer from what they say, and they are not aware of them being watched or observed. So that's what I would argue, that our approach tend to be less affected by bias than the conventional approach used in psychology and similar domains. But yeah, the bias is an issue. And that's an active area of research in artificial intelligence and machine learning.
Right. And there was a question that came in about, are you ethically required to report any self-harm threats that you found, particularly in the study about depression? If you find something that is worrisome, what ethical obligations do you have to connect that person to resources?
That's a very tough question to answer. So because we take a passive approach, so far, at least in our research, we have not interact or intervene with the subjects of study, right? Sometimes we actually don't have a way to reach them. But in some, critical situations or life-threatening situations, it's a bigger ethical question that we don't have a good answer for, to be honest.
I'll ask a follow-up on that. Do the subjects whose tweets you're using, do they know that you're using their tweets?
They don't know, right? But tweets are public data that anyone can, read and observe. So the subjects are aware of that fact that everyone can read their tweets.
Okay. But they don't know specifically that their tweets were. So how do you find your subjects? Is it just a random sampling of users, or how do you select your subjects for whose tweets you will be using in your classifiers?
Okay, so I'll give a high-level answer, and then Hanjia and Yipeng may add to that. So in general, we use random sampling, and we do it so by specifying keywords, right? So with the keywords, we collect whatever tweets that contain that keywords. Therefore, during the data collection process, we are not aware of, say, the demographic status of the users, right? It's purely based on sampling tweets. And then from the tweets, if someone has posted many tweets about COVID-19, then we can follow this particular user to get more data from this user. Okay. The two of you have anything to add?
I think Professor Luo has just answered that pretty in pretty detail. And one thing I want to add is that the Twitter API we use, Twitter already gave us a sampled data set. Yeah.
Yeah, so what Hanjia is saying is we are doing random sampling on top of their sampling, which hopefully is random. we have no way of knowing, you know, how they sample the streaming data.
Sure. So I have a question. I mean, this is something that you could not have imagined doing any of these studies even 10 years ago, right? Because social media hadn't reached the levels that it is at now. The access to the data wasn't there, but especially in terms of the innovations that have happened in machine learning and AI and the ability to mine data in the way that you're doing. So, you know, we've come a long way. What, in your opinion, is still needed? What are the missing areas? What are the challenges in terms of doing research like this, where you're doing data mining, and how do you see that evolving moving forward?
Indeed, I think we could not have done this sort of research 10 years ago or even 5 years ago. I think that the data wasn't there. The machine learning algorithm wasn't there. Also, the acceptance wasn't there. When we first started doing this line of research, we ran into, you know, resistance by the research community, right? They ask questions, you know, how do you ensure that your data is not noisy, there's no bias? But the noise and bias issues exist in all studies. It's not just in big data. And if anything, big data gives us the opportunity to reduce the effect of noise and bias, right? Going forward, it's going to be, to us, I think we are finding more and more applications of this type of approach. You know, we did this type of thing for, you know, elections many times before, and this year we choose to focus on COVID-19 pandemic. And there are other social issues to study using the same approach. And this now is a separate field called computational social science. So that has a different flavor. I think going forward, I would like to see a convergence between the traditional approach, which is based on a small group of subjects, focus group, so on and so forth, interviewing, and big data driven approach, okay? Because that one is limited by scale, limited by whether it can be done real time, which are the advantage of the big data based approach. But in our case, we actually, once we discover some insights, it is useful to take these insights and verify them, confirm them with recruited subjects. So in other words, our data-driven approach can inform the small data, the conventional approach. And then the conventional approach can at the same time give us questions that may be answered by big data approach. So I think the two sides can go together. And if we combine the two approaches, we can avoid the pitfall of each one and get the best of the both worlds.
Yeah, that's very interesting. So an approach that keeps the human in the loop in some sense, but makes it much easier for the work that the human in the loop has to do.
Right. So, and let me give you an example since we have time. So I talked to someone who's writing a proposal on the next generation face masks, because the current generation of face masks are not acceptable by a big portion of the population. Many people don't like them because it for whatever reason, right? So they did a focus group study to find out the main reasons of you know, face mask refusal, right? But the problem with that approach is it could be limited by who they talk to. Okay, they can only talk to so many people, right? So now, as they are developing next generation of face masks, they would like to collaborate with me and my group. So So they'll rely both on a sole focus group and the big data approach. So they are best informed when they design the next generation face masks. They are also studying the acceptance of vaccine because the vaccines are coming, but not everyone wants to get vaccinated. So this type of issues, can be studied by both approaches. So we are best informed.
Great, great. Well, one thing that I think a lot of people are interested in, given we're something like 6 or 7 weeks away from the election, is how extensively do you think these techniques that you're talking about are used in politics and marketing?
Okay, that's a good question. So in the 2016 election, we published a series of papers, and we were able to discover many insights that the mainstream media were not aware of. But after the election, it turns out President Trump had a team that were doing something similar. So he can run his campaign accordingly. I think that's sort of known. That became known afterwards. But as we were doing that type of research, at least one campaign was trying to do the same. So what I expect to happen is this year's election will be no exception. And I think a data-driven approach will play an even bigger role.
Great. There were a few questions that came out about your data set. Is it a US population or international? And have you thought about comparisons and looking beyond the US, or is your approach mostly focused within the US?
So far, our projects focus on US data only. I mean, Twitter is an open platform, so that's why we choose Twitter. Okay, we would like to use Facebook, but Facebook data is mostly private, right? And also Facebook, Twitter are actually prohibited in countries like China. So even if we want to study same issues in China, we couldn't have done it with Twitter data. But I have some incoming students who couldn't get a visa. So while they are still in China, they did collect data from Weibo, which is the equivalent of Twitter in China. So we also, did similar studies with interesting findings. But for this, the work we talk about today, they are all limited to US population.
Okay, and one other question that came up that's kind of interesting, and I think unfortunately this has to be our last question, is the sample of users who use Twitter is in itself potentially a biased sample, because not everyone uses Twitter or is a regular user of Twitter. So how does the biases of those who are using Twitter versus not come into play here? And have you thought about how you could address that?
Yeah, so the bias is there, right? So Twitter users are a self-selected group to begin with, right? However, this type of systematic bias can be compensated for if we know the demographic distribution of Twitter users versus the demographic distribution of the general population. We can remove the bias because we can compensate for the differences in the distribution. So we haven't done much of that because the Twitter user population is actually fairly similar to the general population. I'm saying this on a relative term. If you compare Twitter users and Instagram users, then we know that Instagram users are mostly younger people. So there's an even bigger mismatch there, right? So Twitter, I think, they are statistically published about the distribution of users on different social media platforms, which can be accounted for systematically to remove the systematic biases.
Great, Okay, well, thank you so much for the very interesting discussions and presentation. And I'd just like to invite each of you to give any closing remarks or thoughts you might have after this discussion, and then we'll wrap it up.
I think I've talked too much, so I'll give the opportunity to my students. Go ahead. Yeah, Hanjia, you can go
Okay.
first.
Yeah. I think this is a very interesting project. They are very interesting projects, and I'm happy that I am part of the research group to be able to investigate the insights into the social media during the pandemic. And also I have seen a lot of interesting questions in the Q&A bars, and I think I will keep them and try to find if there are any potential future research directions. Yeah.
On that note, is there any way we can save the questions in the chat window or in the question and answer session?
I do believe we can, and we will. So we'll be able to answer some additional questions because it was great. And I want to thank the audience for asking so many interesting and insightful questions. Unfortunately, we couldn't get to all of them today. But Yipeng, I'd be interested to hear if you have any final comments.
Yeah, I'm also glad that I'm part of this research project. I think AI is a powerful tool on social media that can tell us a lot about this. The people's what people are thinking about the pandemic and how and their mental health conditions. But yeah, I think many of the questions are great, and there are many future works that we can do about removing the bias, etc. And we can also think about the ways to actually, as people mentioned, to cooperate with psychologists, psychiatrists to expand our impact of our study.
Wonderful.
Okay, so I just have the final word. I want to thank Dean Heiselman for joining us from her busy schedule. And I want to thank all the people behind the scene to make this event a success. Finally, I also want to thank people online to join our discussion.
Great, thank you. And I will now turn it over to Abby, who is going to wrap things up.
Great. Thank you, Professor Luo, Dean Heinzelman, and Hanjia and Yipeng for that wonderful session. I'm excited, hopefully, to learn more about your research in the future. And thank you all for joining us today. We hope you enjoyed the program and we'd like to hear your feedback. Please take a moment to share your thoughts about the session through a brief anonymous survey. The link for the survey will appear on your screen at the end of the webinar. Select Continue to get to the survey. Please also plan to join us next week on Saturday, October 3rd, at 11:30 a.m. Eastern Time for a special virtual lecture, Women Who Rock, Voices of Our Leaders, featuring President Sarah Mangelsdorf and University of Rochester Deans Gloria Culver, Wendy Heinzelman, Marianne Mavrinac, Sarah Payray, Kathy Rideout, Shevin Yeltikin. This event is being co-hosted by the University of Rochester Women's Network. This special panel discussion is part of Meliora Month. Though we won't have a traditional Meliora weekend this year, we can still participate in a wide range of intellectual and engaging University of Rochester programs. Meliora Month 2020 will be live and online throughout October. More information on Meliora Month will be sent out soon. Have a great afternoon, everyone. Stay well.